when you're dealing with mental health, you have to know a few things. So alternative practitioners, when we're saying this, are hypnotherapists, and some counsellors typically cannot work with severe mental illnesses. And these are the reasons. Because, so number one, safety concerns. The lack of medical training to handle crises or emergencies. You just are not trained to do it. You're unable to prescribe or adjust medications because you are not a trained doctor, you are not a trained pharmacist, you are not a trained professional in that way. And people have got to be very careful when you're doing this, because you actually are up for liability if you're not careful. The risk of inadvertently triggering or worsening symptoms. Triggering or worsening symptoms can happen, especially if you're dealing with bipolar people, because you could have the client, say, for example, one day you work with them, one session, and the next session, they are a completely different person, and they've forgotten what you've done. And because their mind is like a split personality, it's incredibly difficult. And you have to be very wary, and you have to look for telltale signs. So, and then the legal and ethical obligations to refer to appropriate medical care. We can help and give people advice to say, like, go to medical care. There are certain things we cannot do. We just cannot do. We have to understand.